Hi, and welcome to Cardiology Basics. This education is to discuss medication groups and common diseases related to the cardiology site. This is intended for any clinical support staff who are interested in learning more about basics of cardiology, medication groups, and common diseases. My name is Megan, and I can be reached at mthomas@umphysicians.umn.edu if you have any questions or comments regarding this education. The estimated time to view this without voiceover is about 20 minutes, with voiceover really about the same. The purpose here is to understand basic cardiac medication groups and then describe the most common cardiac diseases. Just a side note, this lesson is not intended to be an all-inclusive review of cardiology. This is a basic, high-level overview, and the information should not be used to educate patients. If patient education is needed, it should be completed by the provider or the registered nurse. This module is divided into two topics: cardiology drug classes or medication groups and common cardiac diseases. So we'll start with medication overview. As you can see here, there are several categories of medications that are specific to treating conditions of the heart. We have them listed here in alphabetical order, starting with anticoagulants and moving toward vasodilators. We will go through each category and then some examples to more completely understand each product. This is a review of medications only and does not include non-pharmacological treatments that are used through integrative healthcare. We're going to start with anticoagulants, and this decreases, by taking this decreases the coagulating ability of the blood or clotting of the blood. You might know them as blood thinners, but they don't exactly thin the blood. The reason that they might be prescribed are someone already has clots, or we're trying to prevent future clots, such as stroke, or current clots from becoming larger. There's a list here of some really common anticoagulants. Heparin and warfarin are very familiar. And know that as we go through medications, we're going to be talking about the generic name in our examples today, but all medications have brand names and generic names if they've been approved by other distributors. And although we'll talk about reasons they're prescribed, there may be many, many reasons that the medication is prescribed for that particular individual. This just covers the very common instances. You may work with patients that have arrhythmias of various degrees. Some arrhythmias don't need medical intervention. Those that do, this medication group helps to control irregular heartbeats. Common anti-arrhythmias, amiodarone is a really common one, and I have a few listed here that you can also look up as far as medication groups. Antiplatelet agents, also noted here is dual antiplatelet therapy. This prevents clots from forming and prevents current platelets from sticking together, really. So if someone has had a previous heart attack, or they have unstable angina, meaning they have chest pain, a history of stroke or transischemic attacks, this can help treat those. ACE inhibitors are another really common group of medications. It stands for angiotensin converting enzyme. And what that does is expand blood vessels to decrease resistance by lowering levels of angiotensin II. So what this does is allow blood to flow more easily and make the hearts work easier. The reason that it's prescribed is for high blood pressure or potential patients that have heart failure. These are your prils: benazepril, kenopril, trandilopril, that PRIL, those are this grouping of ACE inhibitors. Angiotensin II receptor blockers, also known as ARBs, prevent angiotensin from having an effect on the heart and blood vessels, so it keeps the blood pressure from rising. We use this to treat or possibly improve cardiovascular conditions, again, like high blood pressure and heart failure. These are your sartans, losartan, olmesartan. Those are really common medications that you will probably deal with in the ARB family. Angiotensin receptor neprilysin inhibitors, valsartan is a really common med. The neprilysin is an enzyme that breaks down natural substances in the body, and what it can do is open narrowed arteries. So this drug increases the effect of enzyme and improves artery opening and blood flow, and also has an effect on sodium retention. We use this for treatment of heart failure. Beta blockers. You might hear them called beta adrenergic blocking agents. It's the same thing. That term is interchangeable. These medications help decrease the heart rate and also the force of the contraction, which has a result of lowering blood pressure, and it makes the heart beat more easily and more slowly with less force. Some of the reasons this is prescribed is, of course, high blood pressure, sometimes cardiac arrhythmias, prevention of future heart attacks, and chest pain. These are your LOLs, your LOLs, acebutolol, bisoprolol, propranolol. When you see that LOL, that's a common ending for beta blockers. Another group of meds is combined alpha beta blockers. Again, this helps decrease heart rate and force of contraction. As an effect, it lowers blood pressure and makes the heart beat more slowly and with less force, like the beta blockers. The treatment is for high blood pressure and heart failure, and a common alpha beta blocker would be carvedilol. Calcium channel blockers, or calcium antagonist and calcium blockers. These are common other interchangeable terms. Calcium has a really big effect on the contraction mechanism of the heart. So what this does is it interrupts the movement of calcium into the cells of the heart and blood vessels, and it can decrease the heart's pumping strength and relax the vessels. These are often used to treat high blood pressure, chest pain caused by reduced blood supply, and sometimes arrhythmias. Amlodipine, diltiazem, verapamil, these are really common medications that you might see in your clinic site. Cholesterol-lowering medications is another group, and this lowers your blood cholesterol level, so your LDL, which is considered the bad cholesterol. These are your statins. Fluvastatin, lovastatin, nicotinic acids all fit in this cholesterol-lowering medication group. Diuretics are also a really common medication, either alone or with other groups for heart disease. What diuretics do is it helps to rid the body of excess fluids, which reduces the work on the heart. So you see this in a lot of heart failure patients that are having excess fluid in cavities of their body or in limbs. You might see it visually, and it works with the sodium of the body, attaching the water to sodium. Furosemide, torsemide, these are all meds that fit in this diuretic category. And then lastly, vasodilators. So vasodilators relax blood vessels and as a result can decrease blood pressure. It also can reduce chest pain. These are like nitroglycerin is a really common med that you'll see. Nitro is the most common medication that you'll see in this category. It can be by a pill that's swallowed. Most commonly it's sublingual, so it can just sit under the tongue or in the cheek to help with chest pain. And it also comes in a spray and topical cream. As you can see, there are many medications that are used to treat heart disease and prevent future damage. These are often used in combination with each other or other medication classes and accompanied with non-pharmacological interventions such as nutrition and exercise. All medications, and especially when a patient experiences polypharmacy, which means 3 or more medications that a patient is taking at a time, may have mild to serious side effects. Some side effects do create the need for supplements, such as potassium or stool softeners, for example. So why is all of this important? Cardiovascular diseases are the leading cause of death globally. An estimated 17.9 million people died from cardiovascular disease in 2019. 85% of these were due to heart attack or stroke specifically. Most cardiovascular diseases can be prevented, and we can prevent them by addressing behavioral risk factors, such as tobacco use, unhealthy diets, weight, physical inactivity, and harmful use of alcohol. We're going to talk about some of the common cardiovascular disease categories. First, we'll talk about coronary heart disease. This is a disease of the specific blood vessels that are supplying oxygen directly to the heart. You might also hear this abbreviated as CHD. And the heart's blood supply is blocked or interrupted by buildup of fatty substances in the coronary arteries. This is a largely preventable disease. Like we talked about before, diet, activity, weight, substance use, all of these things contribute to the blockage or non-blockage. Cerebrovascular disease is another category that affects blood vessels that supply the brain specifically. There can be restrictions in blood flow or blockages, or there can be a rupture of the blood vessels. An example, or some examples of this, would be stroke or aneurysms, sometimes vascular malformations. Next, we have peripheral artery disease. You could see this abbreviated as PAD. This is a disease of the blood vessels supplying the arms and legs. So you may feel cold to the touch in the hands and feet, a decrease in hair to those areas, a decrease in hair in the legs where someone used to have a lot, visual signs of poor perfusion, like a blue or gray or purple kind of tint to the skin, or distal toes and fingers. This can be caused by plaque buildup that restricts blood flow away from the heart. Rheumatic heart disease is a very specific type of heart disease that where damage has been caused to the heart muscle and heart valves from rheumatic fever, which is caused by the streptococcal bacteria. Congenital heart disease. So congenital means that it happened at birth. These are birth defects that affect the normal development and functioning of the heart and can cause a varying degree of seriousness. And again, these are malformations of the heart structure from birth. And finally, we have deep venous thrombosis and pulmonary embolism. So DVT, deep vein thrombosis, are blood clots that happen in the veins of the legs. And pulmonary embolism are clots that have dislodged from other parts of the body and have moved into the heart and lungs. I'd like to thank you for your time today in talking about the basics of heart medication classes and diseases. If you have any questions or you'd like further information, please email me on the link above. And these are really great resources here that I used throughout the PowerPoint if you want additional information to expand your knowledge from here.